OK, it is 18 minutes to 7. It's Monday morning. Are you feeling a little bit tired because of your partner's snoring? Apparently, 15 million snorers are driving their families, particularly their other halves, up the wall. In a moment, we're going to get some helpful snore tips from Dr. Hilary Jones, as in how to stop snoring, not how to snore well. First, though, Margaret Graham filmed her husband, William, over the weekend for us. Just take a look and listen to this. It's enough to send shivers down your spine. Well, the long-suffering Margaret joins us along with William from their home in Warwickshire. Good morning.
Good morning.
So, how did you sleep last night, William?
Not bad.
Yeah, and how about you, Margaret?
Well, same as usual, not very much sleep for me, unfortunately.
It's been 12 years, Margaret, that this has been going on, and William there's been lying down, enjoying himself, blissfully unaware of the noise that he's making. How have you coped?
To be honest, I'm shattered most days, exhausted all the time, because his snoring is ridiculous, as you've heard, and that wasn't a bad night really for him that I recorded. So, sometimes it's much worse than that, which is quite tiring.
And in terms of the sleeping arrangements, clearly it's not ideal, but have you talked about one or other of you not sleeping in the bedroom? Like, has he ever been relegated to the sofa?
To be honest, it's quite difficult trying to wake him up, so I usually end up getting up and going to the sofa myself. I can't really go in the children's bedrooms because unfortunately they snore as well, so it's obviously been passed on to the children, unfortunately.
Goodness me, of all the things to pass on, William, for heaven's sake, what are you thinking? Have you always been a snorer?
Sorry. Yeah, always.
And have you ever sought to try and fix it or try and stop? Have you ever found something that helped?
Yeah, earplugs.
What, so you don't wake yourself up?
That's about right.
Yeah. And what about all the things that we've heard about Margaret in the past? Not getting him to sleep on his back and not getting him to sort of maybe putting something in the small of his back so whenever he lies on his back it doesn't have any of these fixes helped?
No, it doesn't matter how he sleeps, to be honest, what position he's in. I've tried turning him over and it makes absolutely no difference. The only move that he could make to stop him waking me up would be a move down the bottom of the garden or something. It really makes no difference at all.
That's why he has a shed, of course. Let's go to Dr. Hilary, because he's here, so hopefully he can offer some solution. It seems to me that William Hills is in a situation where he's not really aware, he doesn't really mind that much, he's always done it, whereas Margaret's kind of getting to the end of her tether.
Absolutely, and there'll be millions of couples up and down the country thinking, that's us, that's exactly what we're going through as well. It's very, very common. The trouble is, it does cause rows, and, poor old Margaret there's not getting any sleep, while,
William's fast.
William's absolutely fine. What I would say to them is that things have moved on in the last few years as regards treating snoring, which is a difficult problem sometimes and can be associated with sleep apnea, which for the bad snorer is quite serious because they stop breathing for several seconds during the night, maybe up to half a minute each time, and that's associated with high blood pressure and heart disease, so it can have a serious implication. What I would say to them is that if it's that bad, they really should get William investigated in a sleep clinic, a dedicated sleep clinic. No two people snore for the same reason. There are lots of different reasons. Some people snore because they've got nasal congestion. If they've got an allergy and they can't breathe through their nose, they'll snore. Some people find that the tongue falls backwards against the back of the throat and obstructs the airway. For other people, it's laxity in the muscles at the back of the throat, particularly people who are overweight and have a collar which is bigger than 16 inches in circumference. People who drink at night.
So there's all sorts of reasons. Just for William and Margaret's sake, what would you, other than going to sleep clinics, I think they've tried that and it's just about getting William to the sleep clinic. What about products? Is there anything that you can suggest?
Well, there's lots of things on the market. I've just got a few here. I mean, you've got herbal nasal sprays, you've got the strips which you apply, so you stick over the top of the nose to open up the nostrils, and these things which look like gum shields.
Yeah.
This is a mandibular advancement device. You wear those on your teeth and it pushes the lower jaw forward, so that if you're somebody that has a tongue falling
drops
backwards,
back.
it prevents the tongue falling back. And they can be very helpful once you've got that diagnosis.
Yeah.
But you really need to get that diagnosis first, and you can't just guess, because those things aren't going to work for everybody. I would go to a sleep clinic, find out what the exact diagnosis is, and then you can have something done about it. And if necessary, there is some minor surgery you can have done to tighten up the soft palate, or even a CD to help you train those singing muscles.
To control it all.
To control those muscles at the back of the
So
throat.
there are some options, which is the most important
Sure.
thing. Hopefully Margaret and William will benefit from those. Hilary, thank you very much for popping in this evening.
Or set up a bed in the shed.
Or set up a bed.
There is that.
Yeah, you can find more helpful advice and tips on how to get rid of snoring on the website gm.tv.